Well, a second wave of the COVID-19 in the country has brought with it additional cases and more deaths. Those persons who seem to be having a fatal encounter with COVID-19 are those who have one or more comorbidities. Consultant and Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nakia Forbes, stressing why people should not let their guards down.
Try not to get COVID-19 in the first place if you have these medical problems.
The advice from Consultant and Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nakia Forbes, speaking to comorbidities that have contributed to a number of COVID-19 reported deaths since the July wave. So far, just under 100 people have died from COVID-19 in the country. Those comorbidities include high blood pressure, diabetes, obesity, lung disease, or other factors that affect a person's immune system. 47% of the population suffers from high blood pressure, while 26% has diabetes. With a number of Bahamians faced with one or more of these diseases, Forbes says following safety protocols is paramount.
That includes staying at home as much as possible or leaving home only to do the things that are essential errands. Wearing a mask when in public, even with the mask, staying at least 6 feet. 6 feet is better away from other persons if you're wearing a non-medical mask. Even some medical mask, if you're really close to someone with COVID-19, some of those particles may still get in and you could breathe them in.
The aim, she says, is simply trying to reduce the risk of contracting the virus or coming in contact with an infected person. A healthy lifestyle may also assist.
Remember, when we think about health, we have to think about it holistically. We have to think about all the factors that contribute. A healthy diet, getting enough sleep, stress management, eating a healthy diet, a healthy balanced diet with fruits, vegetables, carbs, proteins, and healthy fats that will allow the recommended daily allowance of vitamins, but taking a vitamin supplement can also be helpful.
With the peak of cold and flu or allergy season almost upon us, Dr. Forbes is urging people to get their flu shot.
So imagine that flu symptoms overlap COVID-19 symptoms. That's going to cause a lot of concern. And again, both of those can cause pneumonias. So it could increase hospitalizations of people, especially for people who are vulnerable. So what's the news you can use after all of that information? I always like to say, well, what can you actually do? You could get a flu shot. Flu shots are available. They're now available in the public health system. They can protect against the flu. They have a 40 to 60% efficacy or ability to be able to protect against what is predicted to be the circulating strain of the flu.